Hey team, it's your friend and colleague Jesse Green, and you're listening to another episode of the Savvy Dads podcast. Welcome along. It's great to have you here. Now, I want to talk today about a strategy to fill your books without spending any money at all. Now, I've got to tell you that when we ran our two practices, we grew both of them to multi-seven figures without spending money on advertising. I'm not against spending money on advertising, but I don't want to spend it unless I actually have to. So last night I had a conversation with a practice owner who was coming to talk to us about how they could fill their appointment books. And when we asked a few questions, we dug a little bit deeper. It turned out they had 1,200 active patients and an additional 4,000 patients who are inactive on the database. And that's a latent asset. Most people focus on the active patients only, but the real truth is that inactive patient base is an asset that's often being underutilized. If you think about this for a moment, imagine you're a farmer. Imagine you've got paddocks in your fields and you're thinking, well, I'm planting 2 or 3 of these fields, but there's all these other ones underutilized, but I want to go and buy some land next door. You wouldn't do that, right? You'd use what you've got already. And it's the same with this situation as well. And so what we looked at for this particular practice that was speaking to was how could we reactivate some of those 4,000 patients and get them back through the doors. The reality is those patients are just waiting to be communicated with. And it reminds me actually of a story. Many years ago, my youngest daughter, Maisie, faked the fact that she needed glasses. She was sitting in class and pretending she couldn't see the whiteboard because she wanted to have glasses to look cool. She's at that age where she thought glasses were cool. Notwithstanding that, we were very diligent parents. We took her to the optometrist. She faked the eye test and we got her some glasses. Now, after we'd got her some glasses, she then later confessed that she'd faked the eye test and she didn't really need the glasses. So despite the fact that we'd wasted some money, we were in the system of the optometrist. And I remember over time, he'd sent us a letter. And he'd sent us a letter saying, look, come in and get Maisie's eyes tested. She's due for another checkup. And that letter sat on our fridge for ages and ages and ages, and no one followed up with us. No one called us. No one emailed us. No one did anything. And in fact, we would have taken her back for another eye test because, trying to be good parents, you just want to be sure about these things. But the fact that no one called us meant that it was never top of mind. And this is the problem that most people have with their reactivation processes. They send one letter, they make one phone call, they make one thing and send it out, and they cross their fingers and they hope and they pray and they wish that patients would come through the door. And it's a real mistake. So when it comes to reactivating lost patients or inactive patients, you've got to understand that it's a campaign. And a campaign has multiple touch points, multiple pieces of communication across different platforms. Because in this case, they sent us a letter. But if they'd made a phone call or sent me a text or done something else, maybe that would have been the medium that I responded to better. So when it comes to your practice, remember that a reactivation campaign consists of multiple pieces of communication across multiple different formats. So you might have a letter, you might have a postcard, you might have an email, you might have a text message, you might have a phone call, or any of those things in between. And so when you start thinking about reactivation, the first thing you want to do is to map out that sequence with how you're going to communicate with those lost patients. So map out the different touch points, the time between them when you're going to do this. The second thing that you're going to do is then to print out your list of inactive patients, and you'll be surprised at how many there are. If you do some basic database hygiene, you'll realize that there are so many people who have fallen through the cracks. The problem is that when they leave or fall through the cracks, they don't do it in a noisy way. So, it's kind of like silent reflux. It just happens. They leak out the practice without ever realizing. So print out that list and make sure you then triage that list. Now, the way you triage that list is you find the people who've been in most recently. And the reason that's important is the people that have been in most recently still have the strongest relationship with your practice, and they'll be easier to reactivate than those people that have been gone for some time. So that's where we're going to start. Once you've mapped out your communication sequence and you've created all the pieces of communication, you then printed out your list and triage that list. What we're going to do is batch that list into small batches of, say, 50 or 100, and then start that process of reactivation. Remember, you can run several batches at once, but try to batch them, and it's imperative that you measure your results. So when people receive the communication, if they respond and they come into the practice, obviously they don't get the rest of the sequence. If they have yet responded, then continue with the rest of the reactivation sequence. And what you might expect over time is to have roughly somewhere between 15 and 19% of the patients on your inactive database come back into the practice. And that's a really large number. We have run this program for many practices over the years. And I can remember on one particular occasion, one of the practices we worked with brought in something like 350 new patients from their reactivation program. Now, of course, they had probably 15 or 1,600 inactive patients that they were working from, but 350 patients is a large volume of patients. And when you think about that, that's a couple of days of dentistry for an associate across the year. That's a couple $100,000 of revenue across the year. And all it costs is a bit of time, maybe a couple of stamps, a bit of postage, and a few emails and whatnot across the way. So it's definitely worth your effort. It is one of the most overlooked, underutilized, and yet really valuable ways of bringing patients back through the door. So remember, if you are losing patients, you've got to plug the leaks, like we said a few weeks ago. But if you've already lost the patients, we now need to get those ones back through the door, and we do that with the reactivation program. So let's get to some Q&A, and this question comes from Debbie all the way in WA, and Debbie's asking, how do I know when enough is enough when it comes to reactivation? And it's a great question. Like I said earlier with my daughter Maisie, I wished that the optometrist had followed up, because if they had, I would have taken action on it. They could have sent me another letter, a postcard, an email, a text, whatever it is, and I would have actually been grateful for it. Now, even though we didn't actually need those optometry services, I still would have proceeded with it, like I said before, to make sure that my daughter was getting the best possible care. But because no one followed me up, not one letter after the initial one, not one phone call, not one email, not one anything, I didn't take action on it. So remember that your patients are busy. Your patients have many things going on in their lives, just like you do, just like I do. And so those prompts and reminders are actually valuable and helpful for them. So once you've done your reactivation process, which might include 6 or 7 touch points, if at the end of that you've had no response from patients, what you might want to do is to send one final piece of communication. Say, Mrs. Jones, it's Debbie from XYZ Dental Practice. I'm writing to you because we've invited you back into the practice on several occasions, and I don't want to be pestering you or annoying you. I'm going to archive your file for now, but please understand that you're always welcome to return to the practice at a time that suits you. Our doors are always open, and we look forward to seeing you if and when the moment arises. And once you've done that, after completing your reactivation program, you can close the file and archive it, and then know that you've done everything that you can. But like I said, the biggest risk is actually archiving them too soon, because everyone's busy and those reminders are actually really helpful and really valuable. So Debbie, I hope that answers your question. And gang, till next time, have a good week and look forward to seeing you then. All right, bye for now. Hey everyone, it's Jesse here. I hope you enjoyed that episode of the podcast. If you're looking for some more tools, some more insights, some more inspiration to help you create a practice that you love, as well as a life that you love, well, head across to savvydentist.com and check out all the goodies that we have there waiting for you right now.